Hi guys, my name is Dr. Michael Doe. I'm a general pediatrician. With DMG, but here at Valleywise Health, and I am the director of our Valleywise Pediatric Refugee Clinic. I was born in the United States, specifically in Texas, to Vietnamese refugee parents. My folks immigrated to the United States as refugees in 1975 to flee the Vietnam War. There's no single refugee story, right? It's going to be because they're from all different parts of the world. There are going to be all different languages, cultures, health conditions, and it's a lot to juggle on top of just regular child health, right? And so one of the ways we try and address some of the challenges in working along with our refugee families is with the assistance of our cultural health navigators. And that's a staff member we have at our Valleywise refugee clinics. And these cultural health navigators are absolutely essential to what we do. We call them cultural health navigators because they really do help navigate our families through the healthcare system. In our pediatric refugee clinic, we have cultural health navigators that collectively speak 11 different languages. And that covers a large swath of refugee communities here in Phoenix, which allows us to provide that care to this more special population. The COVID-19 pandemic has, I don't know if highlight is the right word, but it's shown all the different health disparities that exist amongst our disadvantaged populations. Those that are struggling for a variety of reasons were hit the hardest by our pandemic, right? And that was definitely the case with our refugee populations locally. Amongst the different refugee service providers here at Valleywise, we were noticing more COVID cases in our refugee populations in March and April. And we kind of had a mini peak of sorts before the general peak in July and August of 2020. And we knew that they were going to be more impacted by the pandemic. Here you have a population that, with the language, the transportation barriers, how are they accessing healthcare? How are they accessing health education materials to explain what COVID is? How do you translate social distancing into a way that's going to be understandable for our families, right? And shoot, how do you even distance if you live in a home with 12 people, like I was just telling you, like multi-generational homes that are going to be more common in our immigrant families? Not only that, many of our refugee families, they were frontline workers that didn't have the opportunity to work remotely, whether they're in the hospitality, janitorial services, food service industries. They were going to be the ones with the most exposure to COVID in the community as well. And so for a lot of those reasons, they felt the brunt of the pandemic a little harder, a little earlier than a lot of our other folks. But as we talked about it as our Valleywise refugee service team, we started to realize that there was a need for education in a fashion and way that our refugee families would be able to understand and accept. And so we spoke some with the Arizona Refugee Resettlement Program, and in particular our state refugee health coordinator. And we kind of brainstormed and thought a video series would be a good way to put out that health education material. It's having an impact. Different families have come and told us, thank you so much. I hadn't heard this before. No one told me this in my language. I didn't know. Now I know what I can do to keep myself and my kids safe. If you're asking me about my background and my decisions to do it, it definitely came from my interest in global and international health. But I would definitely say that there's definitely been an influence with just kind of my parents' own immigration story. I know they busted their butt to get to where they are now and to provide for me and my siblings. But I also know that they didn't do that without some assistance. And so if now I can provide similar assistance to other refugee families, I think it's pretty cool. I think that's pretty cool to kind of hopefully help folks along like my parents were helped, and hopefully that will make for, better, stronger, healthier families. So I think that's really powerful as well.